Memamu akwaba ever health matters chimedie so aha ye bia ye twetwe apomuden ho enkomo na yesua enuoma a ebeboa ma ya apomuden etumpon. Ende dwuradie yi topic a ye bedi ho nkomo no eye me de pa eye me de. We say last time Dr. Kojo Grant eba ha no make us say obobo conditions bi a scan etimi detect ma make us say ye beto nsa asan frɛ no for some of the conditions, and then we are glad that today we have him in our midst for some of the conditions now. Yeah, can't want some no. It's Kamehona Yankoma Doctor Akaba, Doctor Akaba, and that's so.
Yeah, yeah. Na me hwɛ na metia tiefo ne ahwɛfoɔ nyinaa nso. Nda so de wasese no style ni ba. Bɛkɔ akɔpam bi.
Hey, Doctor, yeah, my dear. Yeah, that's the pastor who Anna invitation. I really appreciate it because there are a lot of misconceptions about this. Emma, I feel say health workers no omujumedie bi efa family planning because of misconceptions and for and then today's topic is about fibroid.
Okay.
So we are here to talk about fibroid. And so doctor, let's just go straight to the point. I think that time no a beating so wrap it up, yes,
okay.
so that we finish
So
on time.
yɛka fibroids
Yeah.
So fibroids it's a non-cancerous tumor
Okay.
that grows within the uterus.
Okay.
Ɛnyɛ ade a ɛyɛ cancerous.
Okay.
Abnormal collection of tissues and growth, abnormal growth ɛba awodie no mu. Ɛna beebi a ebetumi atɔ ɛwɔ awodie no mu nso deɛ ɛdɔɔso bebree. We have locations of them. Ɛna ɛma yɛde tutu ne din. But fibroid itself ne deɛ ɛnyɛ cancerous. It's just a tumor. I say biribi enyin wɔ awodie no mu. Ɛno a ɛnyɛ ba. A wontumi ɛnwɔ no. But it's just a tumor. It's not cancerous. Okay. So that is basically about fibroids.
Okay. Thank you so much. Dr. Amaya Tiasia said fibroid enye cancerous. Me krana meaning say you say a cancerous because it's the abnormal growth of cells. And that is what we all know. Nkofo bebre him say a menstrual disorders na deba. But Dr. Amaya Tiasia said enye cancerous. And the doctor say enye cancerous there and what causes fibroid?
Okay, so for fibroid, there are no known cause.
Okay.
There are no known cause for fibroids. And some researchers say genetics.
Okay.
Say bia wonana na umame and I will be it's likely you will get it.
Okay.
It could be within your gene. And some research and so say it's the exposure to progesterone, long exposure to progesterone, and also it to me a cause fiber. But when you know the researchers are amount for aye but as to a specific cause, say bia udi tomatoes and obenya fibroid, udi bayra and obenya fibroid, umu draw and obenya fibroid, and they be the hosa. So there is no known cause to fibroid. Na your family plan any idea so they don't know when you're fibroid.
Thank you very much. Where the young men are your doctor say, and your family planning, and a bema when you're fibroid. Say, oh, busiamu, una nabi nyabi, maybe will be obviously, and yet automatic, but you are highly so but and your family plan, and yet depo prevera, and yet no original, no, so whatever, and yet, you kind of saying. Tubes ne adeɛ whatever types of family planning now wobɛyɛ no ɛna ɛbɛma wonya fibroid so obi aka bi akyerɛ wo da sɛ wokɔwɔ family planning panne wei a wobɛnya fibroid o wokɔfa wei hyɛ w'awodeɛ mu a wobɛnya fibroid o wohyɛ gyadel a wobɛnya fibroid o ne nyinaa ɛyɛ myth. It's never true. And it is a doctor course bia eni hɔ and the workers no worker say baby a better no na ɛkyerɛ din. So it means that types of fibroids.
Yes.
So the question is, what are the types of fibroids?
Okay. So fibroids ne wɔn bebree.
Okay.
Ɛna uterus no me de begyina hɔ ama pear. You know this fruit pear ya the normal fruit. yɛwɔ 3 sections. Yɛwɔ the greener part ɛyɛ ne ho no, ɛna yɛwɔ aduane no a yɛdi no, ɛna yɛwɔ biribi a aba no hyɛ. Saa pɛpɛɛpɛ na awodeɛ no nso te. We have the parametrium, that is the outer layer of the uterus. Na yɛwɔ myometrium, that is the muscular part. Ɛna yɛwɔ endometrium. Ɛhɔnom no na wotu kosua a ɛkɔgu. Ɛna these 3 sections ni nyinaa no, baabi a fibroid ɛyɛ common paa ɛyɛ the myometrium ɛne the parametrium. The parametrium no sɛ fibroid ne ba awodeɛ no ho a, te sɛ pear, the green part no, fibroid no betua ho a, we call it the pedunculated fibroids. Ɛno no ɛwɔ roots anaasɛ ɛwɔ mfanti yɛbɛka nail connected to the outer layer of the uterus. Nti ɛno no enyi ba awodeɛ no mu, na mmom enyi kɔ the peritoneum, abdominal space na ɛwɔ hɔ no, ɛno na enyi kɔ. And nso etumi yɛ kɛseɛ paa because you have free space, enough space to grow. Ɛna yɛwɔ the myometrium, sɛ wodi pɛ na apoapo wɔ mu a, those are symbol. I'll use that to symbolize a fibroid. Nti the myometrium no, ɛno na ɛwɔ the posterior wall and the anterior wall of the uterus. It is a fibroid ne ba the anterior wall a we call it the subserosal myomes. Ɛkɔ posterior wall na submucosal. And I say if it's at the fundal side heading to the endometrium now, call it the intramural one. And now we can have a cervical myoma, which is close to the cervix. We can have some that will be prolapsing, some of them will be protruding. We have the ring type, there are a lot of them. There are a lot of them. And yes, can the location of it, the size of it, doctors who need to animal.
Okay, thank you very much, doctor. Kyerɛkyerɛmu wei deɛ ɛdɔɔso paa, but yɛn nyinaa yɛmfa na yɛnhyɛ ne nso sɛ fibroid no sɛ na ɛnyɛ baby one place pɛ ɛna ɛgenerate. Yɛbɛka sɛ ɛgenerate because ɛnyini. So it grows day in day out no na ɛyɛ kɛseɛ. Ɛtumi nyini wɔ awodeɛ no ho, awodeɛ no mu, like a lot of places ɛwɔ awodeɛ no ankasa ho ne ne mu na fibroid ɛtumi ɛgenerate. Enti doctor sɛ fibroid ɛgenerate a, ɛdeɛ na ɛbɛma mehu sɛ menya fibroid. The signs and symptoms, what shows say adeɛ wei ɛyɛ me deɛ na kyerɛ sɛ menya fibroid.
Okay, so ebi wɔ hɔnom a they are asymptomatic to it. Meka asymptomatic a na kyerɛ sɛ ɔmo nnya signs and symptoms biara. Ate sɛ ebi a wakɔ hospital akɔyɛ scan na yɛhu sɛ ebi a biribi saa ɛwɔ hɔnom. Ɛna ebi wɔ hɔ nso obenya abnormal uterine bleeding. Ebi a ɔyɛ ne menses ɛbɛba bebree, uncontrollable bleeding. Ebi wɔ hɔ nso ɔbɛ bleeding in clot. Ɔyɛ ne menses a mogya no ɛbɛyi apɔapɔ. Ebi wɔ hɔ nso a nan ase bɛyɛ ne ya, especially the left and the right area, lower region. Ebi wɔ hɔ nso obehu sɛ ne yafunu no ɛyɛ kɛseɛ, and woda hɔ na wɔde wo nsa mia so a, wobɛfeel sɛ biribi dendenden bi ɛda w'ayɛ ase. So those are the signs and symptoms ebi a wode bɛhu sɛ biribi saa ɛrekɔ so. But aside those ones, I just a scan na wotumi adiagnose you sɛ ebi a woanya fibroid anaasɛ ebi a there are traces of it afei na ɛreba. And the scan will tell you then the necessary steps you have to take. You just take them.
Thank you very much, doctor, for this explanation. I think that this will take us back to the last time your discussion about ultrasound scanning.
Yeah.
Say you're about walking in because if say you show you symptoms at a point, because who can say you be an show you symptoms.
Yes.
Sometimes one normal won't show you symptoms and then sometimes so you menstruate to our sisters. You menstruate your blood no but clot a woman. Ɛyɛ na ɛyɛ yɛ sɛ mogya ne ntimi mba nti na ɛyɛ clot no ɛma ɛreba no, it's not that. It could be say ɛyɛ saa. It could also be say we are having fibroid developing back. Nti this takes us back to scanning. We should at least every 6 months. Ɛma no pɔ nka ɛbɛyɛ anka 3 months biara. It's not even expensive,
Yeah, it's not that expensive.
It's not expensive. And yet it can be compared to your wigs, to your entire and your mobile. Sometimes you cry, you purchase it. So, send a young show you something. So one show you symptoms are who says I get way na yo. And now or see a bill one so I am menstruate a beba cloth. Don't say a we ya. Obi ne menses to me and yama a set or take painkillers and I just obi on one himself. There are some drugs we were on one. I think last time TikTok will be saying if you don't know this drug, you don't know what God has done for you as a woman. And then I didn't know that drug too. So some people are quiet to say, oh, menstruating as a one, take drugs, and ye am one own to me, cry and taking the choices into me patch up. Said a bear, ye na yan stressy, and I say, yeah, ending up with complications, no. Yan making sure say you better walking in for scan. Okay, doctor said, and ye show you symptoms there. And your fibroid, a bit near preventing you from getting pregnant.
Okay, so this question is a bit dicey. In a way, yes, in a way, no.
Okay.
So, fibroid preventing you from getting pregnant, I will say no, and I will explain it in this way. Fibroid, no, and yeah, no, they produce ovaries like follicles, eggs, no, sperm, no, fertilizing, no.
Okay.
So, if your tubes are patent, you are ovulating normally, you can get pregnant whilst you have a fibroid. And there are a lot of clients there, more fibroidness, safe delivery. It doesn't prevent you from getting pregnant. And I would say yes, in a way, that when fibroids, embedded to the endometrial region, it can cause miscarriages.
Okay.
And as I got fertilizer na ɛbɛtɔ a wodi anim a because the place is occupied ebetumi ama na cause miscarriage but ɛno kora mpo no nyɛ preventive measure ti deɛ wontumi nyam wei deɛ wanyam na asɛe that is one thing but to prevent you from getting pregnant there are a lot of clients with fibroids and they're able to go through that.
Thank you very much. Nti wo a wotie mi a obi aka kyerɛ sɛ fibroid nti na wontumi nwo ba no. And then me gyina doctor Samson aka kyerɛ sɛ ɛyɛ ntrɔ. It's a big lie. Whether fibroid or no fibroid, wobetumi awo ba. But ɛno nkyerɛ sɛ wohu sɛ biribi kɔ so a ɛnyɛ a be content with it because sɛ wobetumi conceive nti no. But ɔse sɛ ɛba ne ba a fibroid betumi asɛe no. Nti yɛn take caution. It can prevent you from getting pregnant, but it can also let you miscarry a pregnancy. So we should take note of that. Okay, then doctor, from here we move straight to, is there a treatment? Treatment be one more. Mr. Menya fibroid, menya wie, mentimi anhwɛ me ho so yie, mentimi taking note of myself. Emma menya fibroid. Treatment wo ebetimi di ama me ana.
Okay, so with the treatment, I yɛnya rumors bebree so obi sɛ mewɔ fibroid aduro mɛma wɔ aduro ma no ashrinki and a whole lot. Fine, menyɛ medical person, like I'm not a medical officer, a prescriber. But to my little knowledge, fibroid is so hard to the extent that it's just like a tennis ball, cannot easily be melted by a medication. And say esusu a ɛyɛ nketenkete a I think they have a procedure they do vaginally to remove them. But say ɛyɛ akɛseɛ deɛ a the only solution to it is myomectomy. So wɔbɛyɛ operation na wɔyiyi fibroid no fi hɔ. But sɛ ɔbɛma wo eduro a ɛbɛnane no, ɔbɛma wo eduro a ɛbɛba as menses, those are lies. That is my knowledge.
Okay, thank you so much, doctor, for your explanation and education. Okay, nti doctor mayate aseɛ sɛ yɛnya fibroid a agye sɛ surgery pɛ na ebetumi remove na eduro bi antimi nshrink fibroid because ɛyɛ den ɛyɛ adeɛ a ɛyɛ den ɛnyi no ɛyɛ so tough that it can't be melted it can't be melted easily it wouldn't shrink shrinking mpo a still a shrinking a bibi bɛka wɔ hɔ
Still there. The
so
shrinker is still there.
I think say removing it permanently is the best option. And see, so who any problem like this, don't be going up and down, to draw and consume draw because any problem crab bro at the long run. Make sure that you go to the hospital. I will say if you do today be a baby says a baby Don't medicate yourself. Go to the hospital. Get tested. Be sure say saa way cry na me. For all you know, cry na dia wode wadi presume say oh this is what is wrong with me no. And yes sanity it might be something different, something extreme, something beyond over the counter drug, something beyond herbal drugs. Just go to the hospital and then get professionals to attend to you. Okay, doctor, let me come back to you.
Okay.
And yeah, pen baby, yet to say, obi timi kɔ hospital say yɛsɛ wɔ wɔnya fibroid ba wei woyɛ wo menses no na bibi generate wei deɛ ɛbɛkɔ with time no it will go with time no it will vanish wonhu deɛ ɛbɛyɛ is that thing true ɛyɛ nokorɛ sɛ it may happen saa na
Okay, so ebetumi happen saa
okay
whereby there are human errors. Obi a bibi a ɔkɔyɛ scan no wehu nneɛma no yie bi a wama no wrong diagnosis bi a ɔwɔ fibroid anaasɛ biribi saa but later on yɛbɛkɔ akɔ repeat wɔ baabi foforɔ na ɛni hɔ. Those ones are there but aside that one sɛ fibroid nodules ɛwɔ hɔnom a it wouldn't go away. It will be there. Depending on where it's located, it might even grow faster or grow at a minimal pace. When it gets exposure to blood vessels or progesterone and estrogen you produce during your cycle, it grows on a faster rate. And the calcified ones, we call it a ring type myomas. And no, it doesn't grow, say, 2 centimeters, I will be 2 centimeters out till thy kingdom come. We have those ones there. So depending on where it's located and the size of it, ɛna ma doctor bi a ɔbɛka sɛ fibroid wei deɛ isua ɛnha adwen at this time. No, when it is below a certain size, they cannot be removed by cesarean section or myomectomy when it's below a certain size. Nti sɛ at times we do it, yɛhu sɛ fibroid needle about 2 centimeters, 3 centimeters, 4 centimeters ɛwɔ hɔnom a will tell you, oh, fine, fibroid or honor, but for now, there's nothing we can do about it. Because because so small to the extent that when they tend to remove it, they will be cutting part of the uterus, an attachment to the fibroids, until we just leave them. So say benyi ayekesiye, of which they can hold, then remove. And we have I think there's a history or something, I've forgotten the name. But that one, they do it vaginally. They use some instruments going vaginally. Then the smaller ones, you just pick them out with an instrument. That one is there. But majority now may operation maybe on beja manaya kesia about 5 cm and above. That one of which they can hold and remove, then they will do so. Nti sɛ obi akɔyɛ scan na yɛaka sɛ ɔwɔ fibroid but we for the meantime deɛ ɛnyɛ ɔhwee yɛngya wɔ hɔ deɛ a probably that could be the reason behind it because as at that time they couldn't do anything about it ati sɛ ebi ayɛ kɛse ansa.
Okay, thank you so much, doctor, for the explanation. Doctor, Amaya Tiasia said, Ayana ebimu say, Oko hospital, no, and I say, in your hospital per se, Oko and ye check it, Oko with me check in, no. Almost say fibroid na when you know, it's something no abeko. No, doctor say, and sir, and yes, sir, and no abeko, but say, sir, omuntimi enye surgery no, because they might end up so mechicha womb no aka fibroid no ho. Nti ɔmo gya ma ne grow yi kakra ansa ɔmo eyi but fibroid deɛ sɛ ɛwɔ hɔ a yɛbɛyɛ wo surgery na yɛyi efi hɔ sɛ yɛbɛyɛ wo surgery na yɛyi efi hɔ deɛ a ɛnna doctor yɛ nkorɔfo tumi ka sɛ mekɔyɛ surgery but fibroid na asan regenerate what do you have to say about that?
Okay, so with the regeneration, one of the risk factors. So especially with those who have multiple uterine fibroids.
Okay.
You go in for the surgery, the myomectomy. Then American, the smaller ones, it was you got the fibroid nodules na to say uterus no operation na the visible ones and those ones they can hold and no free. Until the regeneration comes in whereby nketenkete no a ntumi ɛnyi no after some years 2-3 years na nketenkete no asan ɛnyi bio
Nti enye dia omo ayi
no
na na se say to say we can we twa body so na we jacket body was a plantain is something na ucha so na uja even the root crack to one more it will come back. So it's not that. But na e wo ho that e can kese na ho na omo ntimi anyi because it's so.
Yes.
Okay.
Nti omo yi kese na nkete na e wo ho na omo ntimi anyi no. Eno na esan ni bio na e be ya akese. So when you do a myomectomy, now omokase be our fibroid na multiple uterine fibroids. Now kwa myomectomy, afashe uti. So iris wa 3, 4, 5 years, you go back for the surgery again because kitten na was no going to me, they will grow back because they are within the uterine cavity and they are meant to grow.
Okay, thank you so much. Doctor say enye dia ye no ene esan regenerate but most of times no eya omo multiple fibroid no omo se esusa nketwa na ewo mu na omo ntimi yin ka kase no eno na esan regenerate e my samba back. It's not like said dia ye no ena ye ja bi wo na se bi ya na se bi enye body enye plantain we ye fibroid it wouldn't regenerate. It's not plantain, it's fibroid. So we should keep that in mind. Yeah, na you say doctor na ye and we try na we jabi. Doctor bi ani won ye na djuma ye o. O ye na djuma ye pan because Ghana say we pass as a medical doctor, as a nurse, Ghana. It's not easy.
Yeah.
You have a lot to read and a lot to know, a lot to account for before you become a health professional, a health practitioner. And your health and Ghana education sector be anye easy. And to obi ambonye. Or yes, obi anye na ejuma ye, or ye ejuma ye, but no problem no, and I ye complicated. And tell the doctor, and ya no bika say, manyem or carry pregnancy to term and deliver with fibroid. They na all deliver no. Na ya ye ni CS, na ye yi fibroid na kan. What about that?
Okay, so was I hoping kind of bizarre question is can fibroid prevent you from getting pregnant? I said no. Nti I'm say for instance when you obey scan you within the first trimester you so fibroid means you know so what can the monitor the pregnancy and the fibroid at also be do 10 which is 36 weeks. Within 36 weeks I will look at the location of the fibroid, whether it's on the anterior lower posterior lower wall, whether it's going to obstruct labor or you can have a normal SVD. You say if fibroid no fundal side and I say the anterior up or posterior upper, you cannot allow for a normal SVD. But if it will obstruct labor, say a blockade birth canal no kakra, and I say it's pressing on the head of the baby too much say onto me and pass it out freely. That is where the cesarean section comes in. And no cramp on a request. And your doctor Diana obey amount, JBR or Koyo CS who's a fibroid or to be. No, you see a specialist on that. Now, kuhu doctor, or share was scan reports. No, ne waka. Oh, fibroid. We were fibroid at the hasi. Na anything I'm person a operation so that we and only akolani then omo ashe no maya. But those procedures are most of the times done by let me see specialists or surgeons. They are mostly done by specialists, either a gynae or a surgeon, and as be a medical doctor or for this watching. Because when the uterus means say or honum now not fibroid and so on, uterus is a hollow organ. It expands with the pregnancy. Nti aya na the handling a bit delicate kakra. Nti obi wɔ hɔ nom ɔbɛkɔ akɔyi fibre and you tend to bleed. Nti ebi wɔ hɔ a they didn't just go there, but the specialist a ɔyɛ gynae anaa ɔyɛ surgeon wokɔhu no na ɔne no discuss a ɔbɛhwɛ wo history, past records with a scan and everything. Edu hɔ nom a na ɔno a ebook you na wakɔyɛ tool ne nyinaa CS plus myomectomy na wahwɛ na wayi afiri hɔ ama.
Thank you, doctor, for this real education. Enti we ema ho sesa wonyam a esa wo ma wo nan yentientia e wo hospital because me no mienu ye hu dia e koso e wo awodie ni mu yɛn ho dia akwaraa ne ne di aprapere we dia te sɛ mame kwan na menyini oso mame kwan na menyini obia pere sɛ obenyini ayɛ kama but yɛn nyinaa so yɛ focus wɔ akwaraa no so wonim a you should be at the hospital frequently ɛnyɛ sɛ wokwan dɛ ɛkyina wonkɔ yɛma waduru a wonno ɛyɛ wo sɛ yɛakyɛ sɛ wabrabɔ twintwan daabi waso nyɛ mmerɛ ɛma apɔmuden nso nsi pi enti yɛbɛda doctor say.
So let me chip in this.
Okay.
So one thing mepɛ sɛ clients ɔmo fibroid ɔmo nyem no ɔmo bɛ expect ne sɛ fibroid and pregnancy a difficult journey.
Yeah.
Because most of the times the fibroid will be struggling with the baby, and as and when the uterus expands, it will be stretching on the fibroid muscles, and therefore it comes with a lot of pain. Nti obi a ɔnyem a ɔwɔ fibroid most of the times onya severe lower abdominal pains, and at times obenya some minor bleedings here and there. But sɛ wo nan yɛ ntiatia wɔ hospital wokɔhu doctor a ɔmo bɛhwɛ na the necessary medications na procedures a ɔwɔ sɛ ɔmo hwɛ na ɔmo yɛ ma wo no ɔmo ahwɛ na ɔmo ayɛ ama wo. But you should bear it in mind that it's painful. Because fibroid and pregnancy, it's painful, and a lot of them at times come for even admissions because of that unbearable pain. But and also in just say solution anyhow. There are solutions when you see the professionals or the doctors. They will put you on medications to do away with the pain, the contractions, and you have a safe and a sound delivery.
Safe and a sound delivery. Thank you, Doctor, for this explanation. I think that we are learning so much our platform. Wow, we sister be our honor. Prompt them so that they listen to us, they watch us, and then they get educated so that we all come together and then have a better health. And see, doctor, san yoma wina yoma it doesn't sound okay. Some hospital na yaka say menya fibroid. It doesn't feel good. Some maybe my worry for so long after na menya akwara ni bi na akwara na ohye me yam no ani fibroid and the agro. It's kind of like heartbroken. And see, again, what can we do to prevent fibroid? Is there any preventive measures I better taking as ladies, as women, as females to prevent fibroid?
Okay, so with the prevention, you have little to do about that.
Okay.
Since it's genetics. So there's no known cause. Say who say be as I way and the cause fibroid na maybe because of away from. But there is no known cause, so there is little you can do about it. But we have long exposure to progesterone, so that one I think some medications, either being it contraceptives or stuff which have that content, you shouldn't be using that frequently. I'll be using prayer once in a while, but if you are you use contraceptives, it will be great, and that might increase your exposure to those progesterone. And but aside another day, there is little you can do. Say a body anaba, but for you to prevent it, it's kind of impossible. So we don't have to check our lifestyle. Then we'll do more checkups to know whatever is happening.
Thank you. There is little we can do. Doctor say about preventive fibroid yet. You be ding say the intake of contraceptives. Say condom is very cheap. Condom is not expensive. Condom is not expensive. Ubema bema no, I enjoy it. I enjoy it tatata. Obe enjoy it. Nenibeji because skin to skin. Now you go and take in contraceptives ebema will complications. At the end of the day, when you fibroid na on safabi. For all you know, for guy no ama will take it so many contraceptives no, and you no be worry. And you no and no be worry because the ones who will marry us no, they don't stress us. They don't stress us, but those that omunim say on worrying, oh lady no men worry onim say on worry. Obema are going through so much stress to his benefit. The thing is, so much stress to his benefit because onim say onware o enti waje agum no wapi agum no wa release agum no onim say you are not safe but still he went ahead to release because I say me release ya me ntimi control me ntimi puli hey bra ubetimi epu and dem pacho go to that pharmacy. Get yourself packs of condoms. Na fashion with them all. So that when that young lady comes, you use that condom. Because the rate at which obi to me taking contraceptive like 3 or 4 times within a month. Are you sick up there? Is something wrong with you? And Ube said the sad thing is doctor, those people, young
Yes,
ladies,
they're
the
young.
teenagers.
They are naive
The
about some of
teenagers.
these things, and I
And
think
the Obenum Lebron too. The next the Obeji Postunu too. Like
a
whole lot.
But I think it's about education.
Whole
We
lot.
have a lot to do on the platform and in our various facilities.
You see,
We have to
these
educate
stuffs
them.
are called emergency contraceptives.
Yes.
It's not something you should be taking every day. If you think your boyfriend or your whatsoever you are engaging sexual intercourse with, on share condom, on pull it out, on abstaining when you are ovulating. Sister, kwasha jadel, kwa depo. Then say you be taking this contraceptive, it's not helping. It's not helping our young ladies at all. We don't even take it twice a month. And I doctor me
every year, at least you should be taking it once.
You see,
for the whole year.
Once a year.
But yeah, they are funny people.
Once a year. Please, let's be stingy with our womb. Let's be stingy with our womb because these men, they are sometimes ungrateful. My young ladies, my sisters out there, we can't sacrifice so much for a man who doesn't even know our parents, for a man who hasn't even paid anything to our parents. No, we can't do that. We can't risk our life for them. I am begging you. The next time you will invite doctor here to talk about contraceptives because it's a delicate issue. My young ladies out there, let's be mindful. Let's be health conscious. After 5 minutes, now you're God. Kacho, if you are not in your free period, don't go and do it. If your boyfriend, I know some of us, somebody like me, I'm allergic to condom, even though I haven't had sex before. I haven't had sex before. I'm a virgin, but I know I'm allergic to condom. In Zambia, I meet someone I love so much. I have to give in to him. As I'm a man of crime, I can't share my vein.
Chairman will hear this, definitely.
As I'm a man of access to do the doer. I wouldn't let him use condom because me are allergic to it. So if me said me are ready for pregnancy, I think the best option is that I am in my free period. I have this flow up. Yeah. So I am free. I can do it. Not to go and do it today. Lydia. Tomorrow manum postono. The next day nama fa and Levron two and then.
I think for we are not advertising for them.
Yeah, sure.
But we don't want to bring down their labels as well. So some of these things, I think we can just put them quotes, emergency contraceptives, than to be mentioning
their names. Okay, sorry to any brand you mentioned your name. We are not bringing your business down, but we are telling the young ladies how to take it. How to take it. If it happens emergency, like it was an emergency, and then you take it, I think it's good. But it shouldn't be a daily something. Okay, doctor, we thank you so much. We thank you for honoring our invitation once again for this education too. We thank you, but I think we need you here again.
Definitely, I'll come.
Okay.
Whenever you're ready,
we believe
give me a
you.
call.
We believe you.
I'll be right at your doorstep.
All right.
To share. We are educating the public, so
yeah.
and some of the
This
issues
is
we
for
have to
my sisters out there.
we have to address them.
The men are angry. I know they'll be angry, but I don't care. We should be stingy. We should be stingy with them. They should buy condoms. As condom is not expensive. Oh, this is my slogan. If you meet me in town, say condom is not expensive, and I'll wave you. It's not expensive at all.
Wow.
Okay. Thank you so much for watching us, for being with us throughout this time. We appreciate you all so much. Don't forget to subscribe to our YouTube channel, and then you follow, and then you like and comment. Ask every question you want to ask. Question the next time we meet here, we give the question to our doctors, and then they will answer everything. They are really brilliant. They are really, really brilliant. They know what they are doing so well. Thank you. Me a mede dwumadie yi brɛ wo no yɛfrɛ me Efia Daisy. Yɛbɛhyia wɔ ha na wɔtwe sisters so. Bye bye.